Welcome and thanks for joining us. My guest today is Carrie Guthrie, the CEO and President of Cornerstone Montgomery. Carrie, thanks so much for joining us today.
You're very welcome. Thanks for having me.
So we're highlighting organizations around the DC region that prioritize workplace health, not just physical health, but also strong work relationships and psychologically safe environments. So before we start on that, could you just tell us about Cornerstone Montgomery? Tell us what you do.
Sure. I'm the President and CEO of Cornerstone Montgomery, and we are a behavioral health nonprofit here in Montgomery County and also in Southern Maryland, in Charles, Calvert, and St. Mary's. And we provide a wide range of behavioral health services to people who have mental health and substance use disorders.
And when you hear the phrase workplace health, what does that mean to you and your organization? Why is it so important?
Well, it's really important because of what we do. We're part of the healthcare system, so health for our clients is really important. But what we've found is that health and well-being of our employees is also really important so that they're able to provide the support to our clients on a daily basis.
And it's not just good for morale within your employees, but it's also good when you're looking for new talent, right? You can promote your organization and have it stand out, so it really helps you and it helps your prospective employees as well, correct?
Absolutely. As a nonprofit, I can't say that we're always the person or the agency that can pay the top dollar because we're a nonprofit and our resources are limited there. However, we've really focused on what can we do for other benefits and other things that we offer that really are part of total compensation and are things that people appreciate and really like and enjoy as being an employee with us.
And that's a great point because money isn't everything.
Exactly.
If you can provide an environment and a culture that's more attractive than even a different job that might pay a little bit more, you may be that more attractive place for someone to work.
Yeah, and in fact, we have what we call the comeback club. We have many people that leave the organization and come back because they find, oh, maybe it was better, maybe I wasn't making the highest salary, but there were so many things there that I really could appreciate.
So tell us, how do you work to create strong relationships among employees and leadership? How do you create that culture that's healthy for everybody?
Well, it's been a challenge. I will say COVID certainly impacted things because of everyone having to work from home for a while. We kind of lost a lot of the connections that we had, knowing each other really well, spending time together. So we've really focused in the last 4 years on how do we improve that collaboration, that connection again. And our HR department has been key in figuring that out. We have some employee standards or values, as we call them, that employees voted on well before COVID, actually. And 2 of them are things that I even highlight when I orient new staff about communication and self-care. And that's what we've really focused on in the last few years. How can we encourage people to take care of themselves? How can we have better communication so that people feel like they know what's going on, that they can engage, and that they're part of the organization? So we've done a lot of things under those 2 umbrellas, really.
And when you talk about yourself in the community, when you talk about Cornerstone Montgomery in the DC region, do you really focus on that when you're looking for employees, when you know employees are perhaps seeking you out? Do you really put that message out there that you're the place to be if you want that environment, that culture, and that feeling of well-being? Is that something that you really focus on?
Absolutely. When our HR department goes out to hiring fairs, we do a lot right now this time of year with colleges. We talk a lot more than just salary and what you make. We also talk about how we really help with career mapping, with professional development. We have an amazing training program. And in fact, in all of our exit interviews, staff say that's definitely one of our strengths is our training program. So we really try and encourage people to improve their skills. Our HR department will literally have career mapping conversations with people to talk about what are your goals? What do you want to work on? Is that something you think you can find here? Or is that something we're going to help you improve on and maybe you'll end up going elsewhere? And we'll support people if that's what they're looking for. But we have many stories of where staff have started off maybe in an administrative job, but they realize that's not really what they want to do. So we talk to them about it and say, well, would you rather work in a program providing services? And if that's what they want to work on, then we talk about what skills do you need to learn? What would be the program that best suits you? And we have many people who have moved from administrative into a programmatic or clinical position, and vice versa. We've had people who've started off in our clinical programs, but have ended up moving into more administrative roles because that's where they realize their interests lie.
And you mentioned that COVID, it really divided all of us. We had spent so much time alone.
Yes.
And it was something of a repair to the culture that all offices and businesses had to do, and organizations, no matter what you do. Everybody had to just get back together and pick up the pieces. And you mentioned that you really focused since COVID on strengthening that bond between employees and leadership. What specifically would you say you relied on most when you went through that process, getting yourself back together, getting people back together? What did you really rely on the most?
I think the first thing we did was talk about how often people need to come back into the office. We made that decision fairly early on. Some of our programs never worked from home. They have to just be with the clients. But we decided everyone needs to be back in the office at least 3 days a week for the programs or the departments that can actually work from home. So that was the first step. The other thing that we've done is really focus on communication, making sure that people are aware of what's going on. I'm a firm believer in transparency and sharing information with all staff and even our clients. And so we've made a lot of changes there. We have management meetings every month. And right after those meetings, my assistant helps me summarize the meeting, and that goes out in an all-staff email so that they're aware of what's been talked about at the management level. I meet with management teams. Every department has a management team meeting, and I meet with them at least once a month. I meet with one of the teams. Like, I couldn't meet with all of them in a month, but I make sure they have that touch, that connection to me or one of the other executives. We also actually in January just started what we call Progress Together. It's a small group, less than 15 people, and we encourage people to come to that in person, but because we're so spread over these 4 counties, we do it hybrid. And it's just a small meeting where there's no agenda. The staff can sign up to come. They can ask whatever questions they want. We just talk about it. We also have town halls that are virtual that anyone can attend, and we really try and talk about topics. Those agendas come from the staff. What do you want to learn about? What do you want to hear about? And we have those town halls too. So we really try to do a variety of ways to communicate. And then the wellness activities that HR has done every month to try and engage people, those have been extremely successful as well.
So lastly, what advice would you have for other organizations if someone approached you and said, how do we improve our workplace health and culture? What would your advice be generally?
I think I would tell them to focus on the things that we focused on, the communication and the self-care for staff, and try and be creative about it. Our HR department does different activities every month. We have over 400 staff, and over 300 of them have participated in the wellness activities. That's a huge number. That's not typical. And they're all different kinds of activities. So finding those ways to engage people, whether it's through these smaller activities, whether it's through the communication, I think those are places where I would start, because those are easy. Those are easy to start with, and that's been very successful for us.
Okay, Carrie, good stuff. I'd like to thank today's guest, Carrie Guthrie, the CEO and President of Cornerstone Montgomery. You're watching the Leadership in Action series. I'm Nick Iannelli. And for more on this discussion, visit WTOP.com, search Kaiser Permanente.